Now we're going to discuss what a patient might expect after treatment or after an adjustment happens. Typically, we need to tell the patient that if this is their first time being adjusted, or if it's the first time being adjusted in quite some time, months or years or what have you, again, their body may not expect the change we're trying to put in there. And so they may feel some degree of soreness after the fact. It's like going to the gym and working out after a long time, or working a new group of muscles. The body's not expecting a change to happen, and we put a change in there, so it may react with soreness. Sometimes usually not a great deal. It's not extreme amounts of pain. It's just a soreness that they may notice. And if that's the case, then we need to instruct them that, again, you're going to go home, you're going to put some ice on it 20 minutes at a time. After you have it on for 20 minutes, you need to take the ice off, let your body reacclimate to room temperature, just do some easy stretching, and you should be fine. Typically, patients don't experience this soreness, but if they do, we need to make them aware of that. In the event that they do not, typically, as we kind of mentioned before, things that they do experience after adjustment is going to be reduced levels of pain, more ease throughout the area. Some people claim how they feel a little lighter on their feet. They may sleep better that night or in the next coming nights. Additionally, they may have more energy, less pain, more flexibility, all of these kinds of things. Typically, those are the initial things that you can expect after being treated for the first few times.